Paget's disease of the bone. Here is a great schematic that gives a generalized overview of the disease, how it affects 5% of people 55 and older. It's rare under 55. It's slightly more common in men. It's more common in pet owners. It's thought to be the result of environmental factors, but again, or virals. There's not enough evidence and research to suggest this. That just that there's certain outliers and that basically we're able to deduct that a certain number of patients that have Paget's disease have pets. So then we can call this as something, a commonality in these people with this disease, but there's not enough research to actually make a determination. The signs and symptoms are bone pain, deafness if the skull is affected because the vestibular cochlear nerve can be compressed, the pathological fractures, and then in rare cases, as I was saying earlier, the osteosarcoma, which occurs in less than 1%, but it is a fatal complication, especially if you get that accelerated rate of bone turnover, which causes the osteoblast. It is a chronic progressive disease, so it's not fatal unless it becomes cancerous. There are certain diagnosis tests that would be run, an x-ray to see the sclerotic and lytic lesions. There would be lots of dark blobs in the bone, a widening of the bone cortex, bone deformities where you see the bent, or as some people would say bow-legged, you would see that bowed. And usually it is unilaterally. Urine would often contain collagen due to the high bone reabsorption. A bone scan would show the uptake in the affected bones. Then you have the blood, the ALP, a classic type of test. The gamma G rule out liver, which would be ALT and AST. So there's several different tests that would be run that are not written in here that they will discuss later to rule out other diseases. And based on the symptoms and severities would be the treatment. And I listed which ones we would treat, obviously, if the patient's symptomatic, weight-bearing, skull deformity causing migraines, and whatnot. So just review the schematic, and it gives you a great overview of the disease itself.